Hi, my name's Dr. Harold Kim. I'm an allergist in Kitchener, Ontario and London, Ontario. And the following information you're going to see is actually meant for my patients that we take care of in our clinics. But if you're using the information for yourself, it should be used under the management of your physician. This is just a short explanation on allergen immunotherapy. And most of you that are going to start immunotherapy or have already been on immunotherapy will have had this discussion with me in our clinic or with your doctor if you've had it prescribed or recommended by another allergist. Typically with food oral immunotherapy, the idea is not to cure you or your child of the food allergy, but to try to make it safer for you. Some children will actually be cured, but we really can't tell which kids are cured, so we will be recommending that you take the immunotherapy on a regular basis indefinitely, so essentially forever. And so what we do is we start with tiny, tiny doses of the food, and usually what we do is we updose once per month. Some people will updose every 2 weeks, but we found that it's safe and effective at once per month updosing. So with some foods like peanut and sesame, we start with capsules where the dosing is measured out by a pharmacy. And we start with 1 milligram capsule and slowly go up till we get you up to 500 milligrams, and then we flip over to the real food, which would be peanut or tahini, for example. With the tree nuts, what we typically do is we use nut milk, and the brand that we typically use is called Elmhurst, and we get you to purchase the Elmhurst milk, bring it in here, and then we go up in a very similar way to sesame and peanut with tiny, tiny increments till we get you up to full dosing. Again, the idea at the end is to try to get you on the real food. So we'll get you on the nuts or like on the cashew or hazelnut, and you'll take that indefinitely. Really, with this type of treatment, we can do it potentially with any food allergen. For example, we've done it with fish and with eggs and with cow's milk. So we can do it with any of those foods, and even unusual foods like chocolate, we've done it with. So as long as we can measure it out safely and go up really, really slowly, then we can do it. The important points are, although the risk of having allergic reactions with this treatment is incredibly small, especially for really young children, it can happen, so you have to be prepared for anaphylactic reactions. More commonly, children will have oral side effects or gut side effects, so we can give you advice on how to deal with those things. It's really important, though, that there are some what we call cofactors or other things or other variables in our lives that can increase the risk of anaphylaxis. So some of those things that we always point out to patients are exercise. So we don't want you exercising 2 hours before or after taking the food, and this is even when you're up to the maintenance dosing. Colds and flus can aggravate allergic reactions, so if you have a cold or flu that's severe enough, you should hold the food for the day or two that you're having those symptoms. Another important point that we found in a study of ours is that if you take the food after 6 p.m., there seems to be an increased risk for anaphylaxis, so we recommend taking it before 6 p.m. And then other things like asthma and having nasal allergies, and kind of like exercise, having a hot shower or bath during that time may be risk factors. So if any of these issues are there, then we want to talk to you about things before you continue on the food. Again, this is not a cure, it's a maintenance, and the idea is to try to make it safer, improve your quality of life long term, and we do this quite often. Once in a while, we actually use a medication called omalizumab, or the brand names are Xolair or Omniclo, and we sometimes use those drugs to help try to make oral immunotherapy safer. And in fact, we often use those drugs even without the food immunotherapy to try to make life safer for patients. We have a number of patients that are receiving those drugs for food allergy. It's not indicated in Canada for food allergy yet, but it is in the States. And then another thing that we're starting to do now is called sublingual immunotherapy, where we use even tinier doses of food under the tongue that may help protect you from having food allergy. It's best in terms of safety and efficacy to start children on the food immunotherapy when they're younger, but we have done adults as well, but it's more difficult to do adults versus children that are younger. Even once you get into the teen years, it's more difficult to do immunotherapy. But essentially, it's now a widely used treatment for food allergy, and we've done it now probably in over 2,000 kids with food allergy with multiple different foods. Another important point is recently we've started doing more than one food at a time. So we'll often have 3 or 4, even 5 foods done at the same time. And sometimes it gets a bit tricky, but it can be managed. And again, we do that because we want kids to get all this stuff going when they're young. If you're interested in this treatment, make sure you bring that up with us and we can discuss things and go over things in more detail. And again, this is now becoming quite widely performed in Canada, and certainly in southwestern Ontario, we're performing a lot of food immunotherapy.